Strengthen Aged Care Quality Standard 5, Clinical Care, describes the responsibilities of registered providers to deliver safe and quality clinical care services.
As a provider, this means providing older people with person-centred clinical care that optimises their health and quality of life. This supports reablement and their ability to maintain enjoyable daily life activities.
You must understand that clinical care is complex for many older people and requires a multidisciplinary approach with a skilled workforce that is supported to deliver contemporary, evidence-based funded aged care services.
The expected outcomes of Strengthen Quality Standard 5 are Outcome 5.1 Clinical Governance. This outcome requires providers to integrate clinical governance into corporate governance to manage and improve the safety and quality of clinical care for older people. It requires a culture of quality improvement and the implementation of effective systems and processes.
Outcome 5.2 Preventing and Controlling Infections in Delivering Clinical Care Services explains the importance of using antimicrobials appropriately to reduce risks of increasing resistance. This includes the need to ensure effective infection prevention and control.
Outcome 5.3 Safe and Quality Use of Medicines explains the need to ensure medicines are used in a way that maximises benefit and minimises the risk of harm. This involves older people, workers and health professionals and active monitoring of any adverse events. Outcome 5.4 Comprehensive Care requires an overarching approach to the planning and delivery of all aspects of clinical care that an older person requires or requests. The principles and practices of comprehensive care underpin all other clinical care outcomes and actions in Standard 5.
Outcome 5.5 Safety of Clinical Care Services requires providers to identify, monitor and manage high impact and high prevalence clinical care risks to ensure safe, quality clinical care and to reduce the risk of harm to older people. Outcome 5.6 Cognitive Impairment requires providers to ensure older people who experience cognitive impairment receive comprehensive care that is aligned to their clinical needs, goals and preferences. It explains that evidence-based clinical care is essential to optimising the quality of life and safety of older people. Outcome 5.7 Palliative Care and End-of-Life Care ensures older people's clinical needs, goals and preferences for palliative care are recognised and their dignity is preserved.
This outcome recognises that the clinical care an older person receives in the last years, months and weeks of their life can reduce the distress and grief associated with death and dying.
In this Strengthen Quality Standard, some of the actions relate to new topics or expectations. The remaining actions are either in line with or clarify the current quality standards or other existing provider responsibilities.
Strengthen Quality Standard 5 has key topics that connect with all the other Strengthen Quality Standards. To apply Strengthen Quality Standard 5 in practice, you should make sure you have clearly documented systems and processes. Use monitoring tools to show how staff are following these processes and find opportunities for improvement. Work with people receiving care to understand their experiences and care outcomes. Observe how your service provides care. Ask for feedback from your governing body, managers, workers, people you care for and others involved in the delivery of care and services. Use feedback to improve your care and services.
As a provider, you need to understand who you are caring for, what their clinical needs are, and what is important to them. This will be demonstrated through the delivery of clinical care service that is based around what is right for them.
The Commission has a range of resources available to support you to take action and achieve the outcomes of Strengthen Quality Standard 5 clinical care. You can access these resources from the Commission's website.